in particular Department of Mental Health, I have a responsibility as a Director of Community Services as designated under the New York State Mental Hygiene Law to oversee services for people who have mental health issues, substance abuse, and or intellectual disabilities or developmental disabilities. In that role, I've spent a great deal of time over the past decade really working around this issue related to the opioid epidemic. When Dan says this is an emotional story, this is an emotional experience, I think for all of us. We've heard so many stories that where the system has not been helpful, where despite a system being helpful, someone may not have been helped. And I'm sure many of you are here because of your concerns about where a system may have failed or want to tell your story about how it might be more helpful. I have a responsibility tonight in 15 minutes to talk to you about some of the changes that have happened in the national, state, and local systems to impact this opioid epidemic and to try to make a difference. I would like to start out by saying this is not a single discipline responsibility. This is a community-wide response. I have spent 30 years in county government. I have spent 25 of those years in the mental hygiene system. And I have never seen so many multidisciplinary stakeholders coming out to address the issue of addiction. Because essentially, right now, today, we're talking about opioids as the drug, and the impact of that drug has been fatal, as we know. 130 lives lost every day in 2016, 130 lives. That's incredible when we look across our country. What I can say to that is, nationally, we still see 1 in 10 Americans have a substance use disorder. Greater tragedy than that is 9 in 10 of them don't seek treatment. And all of the work that we're doing around addressing the opioid epidemic has to be to reach out to those 9 in 10. We have to be working together to reduce the stigma, to increase the education and awareness. Dan Hubler is one of the greatest advocates for a multi-pronged system, and he'll talk about prevention because he's passionate about prevention. I'm passionate about prevention as well. And our system needs to put more money up front to support those who haven't started using yet. We need to understand that addiction has some comorbidities. It's connected to family members who are addicted. If you have a family member who is addicted, you are at a higher risk of becoming addicted. You can use a substance and become addicted, but somebody else might be able to use it not. That's the genetics that you have. Exposure to traumatic experience increases your risk of addiction. And then personality, a comorbidity with a mental health issue. If you have an untreated or undertreated mental health issue, you're higher risk for addiction. We need to accept that the definition for addiction is a chronic disease. Part of the issue with our country is we have not accepted that, both legally and medically. So we don't have best standard practices that have moved forward. We have best practices, but they're not best standards. When you go to an emergency room and you have heart palpitations or pain in your chest, emergency room knows exactly what to do with it. They know how to respond. They know how to take care of it. They don't always know what to do with addiction and how to move them forward, but they are moving in the right direction. And that's where I want to talk about some of the glasses half full. Some of the things that have been happening to improve the response to this epidemic. I have to tell you today, the U.S. Department of Health and Human Services just announced $1 billion to go specifically towards the opioid epidemic. I am so pleased to hear about their 5-pronged approach. Is $1 billion enough money? I don't know. I don't know, because money alone is not what is going to address this issue, because so much of it is about the hearts and minds of people. It's about not judging people who are addicted. It's about welcoming them when they walk through your door. It's about understanding that things like poverty impact addiction and addressing all of those social determinants that impact this. But $1 billion is coming to address the opioid addiction. And they call it a 5-pronged approach. And excuse me for using my glasses and looking at this for you, because it just came out today and I don't have it all down pat. But they're spending a great deal of funds on better addiction prevention, treatment, and recovery. Better data. Knowing that data is what helps to inform decisions, so instead of willy-nilly putting it here and there, you're putting it where it best needs to be. Better pain management, which we want to get an opportunity to hear more about some of the alternatives to pain management that includes opioids. Better targeting of overdose reversing drugs, and better research. It's good to see some money going into substance abuse system. As I said, I spent so many years in this system. When you look at where our money goes, so little of it goes to addressing substance abuse disorders. We're moving in the right direction. It's because of so many of you, and it's on the backs of lives that have been lost. And I appreciate that there's a response to address these issues. SAMHSA, the Substance Abuse Mental Health Service Administration, did a national survey, and I want to point out to you what they discovered in that survey and what they're reporting out as a result of it. So from 2016 to 2017, they're saying the initiation of opioid use has decreased by 50%. That means new users of opioids has decreased by 50%. That's a pretty incredible stat. They're also saying that, let me just get the numbers right, the number of opioids that have been prescribed from January of 2017 to August of 2018, that's pain management opioid medication, has decreased by 21%. That's also a good thing. And at the same time, the number of naloxone, so naloxone being the substance, the medication that can help to reverse an overdose, the scripts for that have increased by 264%, and the number of buprenorphine scripts has risen by 16%. So when we talk about how do you address this issue from a very multi-pronged approach, one of the things that we do know is that there is a best practice intervention for how you respond to somebody who is addicted to opioids. First of all, you welcome them. You tell them you're glad you're here, whether it's the first time they got there or the seventh time they got there. You listen to their story because their story is important to you. And you do a person-centered treatment plan. And that plan, if opioids is the drug of choice, needs to include an exploration of medication-assisted treatment. So buprenorphine, which is Suboxone, methadone, and or Vivitrol. Because with medication-assisted treatment and good cognitive behavioral psychotherapy, you have a 75% chance of recovery. 75% chance. Without it, pull yourself up by your bootstraps. I got up this morning, I can do this, I'm never going to use again. I'm going to go to 12-step programs, I'm going to meet with my faith-based community, I'm going to hang with my family whom I love. 8% chance of recovery. 8%. That's research-based. 8% chance of recovery. How long do you be on medication-assisted treatment? As long as you need to be. If you have high blood pressure, if you have diabetes, you need insulin, you don't say, well, I've taken it for 6 months and I think it's time to stop. You keep using it. It's a chronic disease and we need to accept it as such. We here in Orange County have accepted that. We've come together as stakeholders across this community. There are private clinicians, there are private physicians, there are primary care physicians, there are board certified in addiction, there are psychiatrists, there are agencies, non-profits that have come together to address this issue. There's law enforcement and EMS and the district attorney's office and the sheriff and our county executive has been involved. I can go on and on with a number of stakeholders. We in this community have said, what do we need to learn? Since 2013, we've had a task force. Last November, we pulled together 200 stakeholders across the system to go on a very, very concentrated journey to look at what do we have today, what's missing, and what's our blueprint for tomorrow. With a national expert, Dr. Corey Waller, who's a pain management and emergency room doctor, and he is a guru around how you respond to the opioid epidemic. He taught us so much, not only at the time he was here last year, but 2 times before that, where he's educating our community. With that, we have 5 work groups that are working together. We're working on medication-assisted treatment. Myself and Dan co-chair that one. because we know that we need more access, and we need immediate access to medication-assisted treatment. We need to look at, across the board, all of those stakeholders who are willing to prescribe and expand those who are considering prescribing. We have the support of our hospital systems. When we look at, oh my gosh, I'm at 5 minutes already. Our hospital systems have a responsibility for screening people who come in who may have an addiction, and then connecting them to treatment. What we're trying to do is expand the supports they have so that that happens, so that the treatment goes into place. I want to talk about a single point of access, but before I do that, I just want to say that by December, we will have a product for our community and best practice recommendations with a list of prescribers, so that it's public for all of you. You can go to the website and you can find out who's prescribing those medications, right? Who's doing the supports, who is the prescriber, and who's the hub that will include the cognitive behavioral therapy. We have a prevention work group. Right now they're focusing on prevention of overdose and death. Big, huge prevention. Starts back in kindergarten, prevention does. But this particular work group is looking at that stat so that we can reverse some of the loss. We're looking at developing a release of information form so that all these stakeholders can talk to each other to best help and serve somebody. We have a first responder task force, which brings in our EMS and our law enforcement and our district attorney's office to be part of the solution, because believe me, they are part of the solution. They're saving lives every day. They're cracking down on drugs, and again, Dean Hoover will talk about all of that. And there's a fifth work group that I'm forgetting. Oh, a universal tool. So we're looking at screening tools. We're looking at the locator. Most importantly, what I've learned from coming out to so many of these forums is our community doesn't know how to access care. There's a belief in our community that there aren't any services, that you couldn't get in. And it's not a false belief, because you've knocked on a door and you're turned away. So I understand that. So we are working to ensure that all of our stakeholders in this community, in Orange County, where we have the most control right here in Orange County, they accept all that I've said here today, that they welcome you when you come to the door, and they say, how can I help you? And they get you in today. They're working on expanding to 7 days access. Currently, there's only 5-day access in outpatient treatment. We're looking at our inpatient provider beds and seeing what's available and what isn't. Looking at the state bed availability to see if there's not a bed available today here in Orange County, where's the nearest one close to Orange County? Because Orange County is number 4 in the state for number of deaths, number of emergency room presentations related to opioid, and out-of-county treatment. So many of our families are feeling desperate and sending their kids to Florida or California or Timbuktu to get their treatment. They're not using the services here in Orange County. And sometimes that's a very costly and not more productive experience. If it was working for every kid that went, every young person that went, every adult that went, I'd say keep doing it. But it's not working. We want them to be able to get their service here at home. We want their community to be their support and their families to be able to come in for those family sessions, because we all know addiction is a family issue. It's not just an individual issue. So in response to people not knowing how to access services, we are expanding our mobile mental health response, our mobile community response to substance abuse disorder, and mental health response. Najah Allen is here today for the Mental Health Association. She and her staff have operated the helpline for us and text for teen line, helpline 24/7 for how long? 2 decades? Beyond 2 decades. We're expanding that call center to a hotline. We'll have professional licensed staff. They will be taking calls not only from people who are in mental health crisis or need information about a food pantry, but also people who are struggling with addiction. They will take the call, they will do the screening, they will do the state leveling tool locator if that's what's needed, and they will, with a warm handoff, link you to all of these services. If I told you about ADAC's peer support that was just funded, or Independent Living's Recovery Center, or HCCS and their Health Hub, if you called me, I could help connect you to services, because I know all of those services, but I know you don't know. So with Najah's help, and the staff will hire and the training will happen. When that phone is picked up, you will know the services here in Orange County 24/7. They'll be co-located in our Orange County Emergency Operations Center with our 911 operators. They will be backup and support. They will be referring some of their calls to us because they get the calls. With our EMS partners and law enforcement, we'll be sending peers out into the field. We'll be sending peers to the emergency rooms to support people. We know that it's very difficult to get out of that cycle of addiction, and with that, we know you need additional support to make that happen. So that is the glasses half full story, and I could go on and on, but I'm going to end it here, and I look forward to your questions and your stories. So, thank you.